All right, good evening, everyone. Thank you so much for being with us this evening. I'm Jennifer from the Adult Services Department of the Scotch Plains Public Library. And as you can see, our presenter this evening is Dr. Erin Walborn. So if you or someone you know experiences tinnitus, you've made a very good decision by joining us for this program because she has over 30 years. She's a licensed audiologist with over 30 years of clinical experience specializing in tinnitus management. And she was a board member of the American Tinnitus Association, has been very involved in education, advocacy, and clinical advancement in the tinnitus field. So I'd like to welcome Dr. Erin and let her get started.
Thank you. Can you all hear me? Yeah? Okay, great. And I see one familiar face so far. Shout out to Deb. Hi there. I went to school with her. That's so fun. All right. Well, my name is Erin, or Dr. Erin Walborn, and I am, as our host said, I'm an audiologist and I specialize in treating tinnitus patients. I also am a qualified teacher of mindfulness-based stress reduction. So I bring that into my work as well. So we're going to go ahead and just move on and get started because the presentation will take about its full hour and then we'll have questions at the end. So I am a board member and secretary of the American Tinnitus Association. And I just want to give a quick shout out if you don't know about them. They have a lot of resources that are available to you. One of them is the Tinnitus Today magazine that comes out. It's got really great resources in there. Everything's evidence-based. They also fund research. So let's talk a little bit about tinnitus and what that is. And at the end, I'll give you a link if you're interested in becoming a member of the ATA and getting that quarterly magazine. There will be a link at the end. So tinnitus is the perception of some type of noise, ringing, hissing, buzzing in your head, your ears, when there's no external sound. I often have people tell me when they first hear it, they think that there's something going on in their house and they go walking around looking for it only to realize that it's within their own head. For some people, they're not bothered by it at all. Other people can feel suicidal over it. So it's something that we take very seriously. And we're going to be talking about ways to lessen how bothersome it is. So what we want to really talk today about is I'm going to give you the anatomy of the ear, a little bit about hearing loss and tinnitus, some tinnitus treatment options, and then working with a skilled provider. So let's talk about this for a minute. Tinnitus itself is not a disease. It's a symptom of something else. And it can take on many different sounds or sensations. It can sound like a ringing, a buzzing, a hum, all sorts of things. And it also can change. So you may notice that it might start out as a buzz and it turns into a high pitch, or you have multiple sounds going on in your ear at the same time. Somatic tinnitus is when we have tinnitus that can be generated through clenching your teeth, moving your head or neck. So we'll be evaluating that on you in just a few minutes. But what can cause it? There are so many different reasons why someone might have it. Hearing loss is 90% of the time the reason why. Could be exposure to noise, trauma to the head or neck, earwax, Meniere's disease, acoustic neuroma. There's other problems as well, TMJ, multiple sclerosis, thyroid issues. So this is why it's imperative that you be evaluated to make sure that it's not a symptom of something more serious. And when we say be evaluated, an audiologist can look for certain things and refer you out if they see anything. Seeing your primary care physician, even an ENT can be very helpful. So when I treat patients, and I know other audiologists follow this, you don't have to be able to read this flowchart at all. I put it in there because it is from the Tinnitus Research Initiative. And they are an international body of research scientists who have put out this flowchart. And it's something that I follow when I test patients to make sure I'm not missing anything medical. So every patient that comes through my door, I follow the protocols of all the testing. And if there's anything that I'm seeing that I need to refer out, you would be referred out accordingly. So ask yourself these questions. If you've come here today with tinnitus, ask yourself, or do it right now, can you change or modulate your tinnitus by clenching your teeth? So you can open your mouth wide, bite down, smile big. Can you change your tinnitus? Does it increase in volume? Does it change in pitch? If the answer is yes, that is a contributing factor to your tinnitus. Can you change your tinnitus by moving your head or neck? So go ahead and move your head and your neck. And maybe you notice that it flares, or maybe you don't. Again, these are signs of contributing factors that we like to look at. This one's important. If you move just your eyeballs, just move them up and down and all around, can you change your tinnitus by moving just your eyeballs? If you can, we would want to send you over for some radiologic studies. Most often, it's not something that's very common. And if you can also try just touching your face and all around and seeing if you can change your tinnitus by doing that as well. That is a sign that it's more somatic, more related to tension. Does your tinnitus pulse? If it does pulse, is it in sync or not in sync with your heartbeat? That's important. If it's in sync with your heartbeat, we want to send you to your ENT or a cardiologist and just have some studies done there. If it's not in sync, then that's okay, but that's something that you want to know about as well. And does food, beverages, alcohol, drugs increase or change your tinnitus in any way? So many people tell me they give up coffee or something else that's really important to them, and that rarely is a cause. So I'd say don't give it up unless you notice a correlation between having it and then your tinnitus flaring. And so here I've put, if you do have pulsatile tinnitus tied to your heartbeat, we do want to refer you out for other studies, and that's how you know when you need to go right to a medical doctor versus being seen by an audiologist. It's one way. So let's look at how we hear. I bring up this because, as we said, 90% of the time, tinnitus is related to hearing loss. I think it's really important for you to kind of understand what's going on in the ear. It's helpful if you've had a hearing test in the past. If you haven't, I encourage you to have one done. But let's look at the anatomy. So you have three parts to your ear. We have this great ear canal with no earwax in it. So when we look in there, we can see right to your eardrum. So sound comes in as a sound wave, hits the eardrum and makes it vibrate. That vibration rocks these three bones back and forth, right? And then that movement pushes fluid into this spiral, this cochlea, this inner ear. So inside this cochlea, we have rows and rows of these cilia, or we call them hair cells, okay? And they're lined up like a piano keyboard. So all the very high pitches, you're born to hear out to 20,000 hertz. We tend to only test to 8,000. For high frequency audiometry for tinnitus, a lot of us do test out further. But for simple speech production, we only test out to 8,000. So all of these hairs are lining this entire spiral, and you can see them right up here. So the tips of these hairs are sitting in this gelatinous membrane, okay? So this is important because think about as sound waves come in and a fluid is coming through, it's like an ocean wave. This gelatinous membrane is kind of wiggling, and it's moving these hairs that are embedded in it. Now, I want to show you this one. This row right here. I'm showing this to you because it's not embedded in it. And later, when I talk about why we sometimes have tinnitus, it's because this one, the inner hair cell, tends to stay healthy. And sometimes these outer hair cells become damaged just from wear and tear. So what does it look like when they're damaged? Well, they tend to bend over. They're not standing up, and the tips of them aren't sitting in that gelatinous membrane anymore. So, as sound is coming and the hair cells are healthy, they're moving, and that sends an electrical signal up to your brain that says you heard. But if the hair cell is bent over, it's like this, right? Here's this membrane moving, but it's not stimulating that hair. And so, this is where hearing loss can occur. This is also a theory of tinnitus production, this this mismatch between the inner and outer hair cells. So this is what an audiogram basically looks like. We have pitch across the top, low pitch, it's here down at the bottom too, low pitch, mid pitch in the middle, high pitch over here on the right. Anything above this black line would be considered normal. In this graph on this side on the right, you can see that it's coming down, and that's where hearing loss can occur from these damaged hair cells. So they're no longer in the healthy region. We tend to see tinnitus at this notch of where the hair cell is lost the most. So it's a very common for when we do tinnitus pitch match or loudness match for us to tie it into your audiogram and see where is it occurring. And where it occurs can help tell us what is the primary reason for your tinnitus. In this case, if the tinnitus were here, I'd say the primary reason was hearing loss. Today, I had someone who it was right here in one ear, and it was up here at 2000 in the other ear. And this is a very typical place for it to be from your jaw. So there's some certain patterns that audiologists look at to help us determine what is the main reason for yours and what are these other contributing factors. And we need to know that so we know about treatment options for you. So some of the current leading theories are this hearing loss, this cochlear damage, or discordant damage theory. And that was proposed by Jastroboff in 1990. And that's where that inner hair cell that's healthy, there's a mismatch with that in the outer hair cell. So sometimes then the brain interprets this mismatch as a sound. Another is this neuroplasticity model, central gain. So when you have hearing loss, the brain can turn up the volume to compensate for this reduced input. And so it's similar to phantom limb pain. The increased gain can produce hyperactivity, which then the brain can perceive as a sound. We also have, and many of you probably have had this in the past, where your ear kind of feels like it goes dead, and then you have this tinnitus that spikes for like seconds, and then it disappears and goes away. And it can come and go, every so often. And that's transient tinnitus. It's nothing to worry about. It's just abnormal firing patterns. Again, interpreted as a sound, and then it goes away. We already talked a little bit about this somatosensory modulation. Can you modulate your tinnitus with your head, your neck, your jaw movements, right? And this last limbic system involvement, we're going to talk more about, because this is why some people are more bothered by it than others. So thanks to the ATA, just a shout out to them, because as funding has dried up, the ATA continues to fund research. And we funded over $400,000 last year toward research. So if that's important to you and you feel like you want to promote more research, you can certainly donate to the ATA if that feels like it's calling you. So let's look at what is going on with tinnitus. Now we know a little bit about why we might have it. Why are some people bothered by it and other people aren't? So you were sent out some questionnaires prior to the class starting, and you don't have to have filled them out right now. But I just want to call to your attention the tinnitus handicap inventory that is in that packet. And we score it, you'll see it's got points right on there. 4 points for yes, 2 points for sometimes, and 0 points for no. And we score how bothersome it is. 80% of people find it to be non-bothersome. Well, some of people find it debilitating, and they're at risk for suicide. And so it's very helpful for you to know where you fall on this graph. And one of the things that we do as I see patients is I'm constantly remonitoring through those same scales that I gave you. And we're looking for at least a 13-point reduction. So what does it mean to treat tinnitus? It's, can I take you from a severe and bring you back to non-bothersome? Can I take you from a moderate maybe to a mild, or a mild to non-bothersome? That's what we're trying to accomplish. There's no cure in that I can't make the sound necessarily disappear, but we can absolutely change how you react to your tinnitus. And so it's important to know, what's your baseline? Where are you at now? So later on, if you haven't done it, you can go through these forms and keep track. As you try different things, go back and rescore yourself. You can see what's working for you and what's not working for you. So this is really interesting. The description of tinnitus, what it sounds like, its pitch, its loudness, where it is in your head, has no relation to the level of annoyance evoked by it. And what do I mean by this? 30 years ago, when I saw two tinnitus patients back to back, one was a younger man who was suicidal over his new tinnitus. And the other was an old farmer who had had it for a ton of years. And he was on his way to physical therapy and just saw our sign and wanted to come in and have it checked out. And later on, when I was writing at the end of the night my notes on it, and I had their papers side by side, they had the exact identical hearing loss. They had the same pitch match and the same loudness match. So what made one suicidal and the other, I don't care. And that's what we're here to explore right now. Tinnitus itself is neutral. It has no meaning. Sometimes we call it a benign body sensation. And this is after, of course, you've had it looked at and make sure it's not a signal or a symptom of something more serious. But in general, it is a neutral signal, no different than the sound of your refrigerator running. So, why do some people suffer more than others? It's a great question. All day long, you are bombarded by sounds. Now, if you're autistic or you know anyone who's autistic, you may know that too much sensory overload can send them into a frenzy. But most people have filters that help the brain to decide, what do I pay attention to and what can I tune out? Okay? So when you first heard your tinnitus, it's really important to find out, what emotion did you have when you heard it? Sound can only become conscious where you're aware of it if there is an emotion linked to it. If sound has no meaning and, something happened, you're like, oh yeah, whatever, it'll go away or whatnot. That's called natural habituation. This is the other thing we have to look at. And this is why we gave you, I believe there's in there a stress paper. I asked you to circle all the stressors leading up to your tinnitus. Because what's been going on in your life leading up to, this says at least 3 months. I like to actually look back at least 5 years. And when we talk about stress, I'm not talking about like you're consciously aware of it. You could be consciously aware of it. But even subtle stressors, just everyday living in this day and age, can take wear and tear on your body at a subconscious level. So looking back, what was going on in your life leading up to when you first noticed your tinnitus? And some people will say, I had it for forever. It just didn't bother me until 3 months ago. That's when it became noticeable. That's when it became bothersome. So if your life was or has been a little bit stressful, crazy, overwhelmed, a new sound can absolutely trigger and send you into a fight or flight. And if you've been in a higher state of fight or flight for a period of time, your tinnitus will automatically take on this reactionary cycle that is happening without you consciously being even aware of it. Does that make sense? So this is the tinnitus reaction cycle. You hear it, the brain doesn't recognize it. It zeroes in on it and says, well, what is that? And then a negative thought comes into play. And then typically an emotional reaction comes into play. And now the brain sees this as danger. I'm going to talk a little bit more about this in a few minutes. But then what do? We focus on it. We're always listening for, is it still there? Is it still there? Right? And then it's this reinforced attention loop. And so it's this vicious cycle. And our job is to break the cycle. And so this is what we work on when we work on tinnitus management. How do we break the cycle? So let's look at what's actually being activated in your body so we know what to work on. If the ear is the source, or even if it's your jaw or something else there, your brain detects it, right? It's at a subconscious level. And then you have an emotional response. Then that triggers the autonomic nervous system. Your heart starts to beat faster. You start sweating. Tinnitus goes up. You have a reaction. And this is where we get the vicious cycle between our emotions and our autonomic, our fight or flight, and the sound. And it continues to make your brain aware of it. Sometimes it flares, it gets louder. So in order to move us from this bothersome state to the non-bothersome state, we have to treat the systems that are involved. We have to treat the ear if the ear is the source, or the jaw, right? We have to treat the limbic system, and we have to treat or understand what's going on in our autonomic nervous system. So I'm going to explore these with you and see how might we do that. But we need to understand what they are first. So let's look at that limbic system. This is a set of structures within your brain. It's the size of a walnut. There's something called an amygdala, right? And it's responsible for memories and emotions. So I want you to think about this scene that's on your screen right now. Cavemen used to sleep outside, right? They knew from just life experience that the sound of a rattlesnake was dangerous. So think about the sound that a rattlesnake makes. A very soft, kind of rattling sound. And they knew in the middle of their deepest sleep, their body was still on alert. That limbic system, that amygdala was still on alert and said, "Ooh, wake up," and either run away or fight it. So I want you to think about your tinnitus. Your body doesn't know the difference. If you had a negative reaction to your tinnitus when you heard it, and most people do, your body thinks it's danger. So it keeps producing it to warn you to run away or fight it off. And the fact is, it's a part. Remember, it's benign. There's nothing there. It's just a sound. So in this case, we can't literally run away from it, right? But what if we stopped and we thought, oh, thank you, tinnitus. Thank you for trying to warn me, but you're not danger, and I know that. Now, that's conscious level thinking. But sometimes we have to treat it subconsciously, and this is where we get into some sound therapy. We're not trying to mask our tinnitus by making it disappear with other sound around. We sometimes are adding additional sound in that we find more relaxing, so our body doesn't hear our tinnitus quite as loudly and doesn't create such a reactionary output as it did originally. So we'll look at sound therapy a little later, but that's kind of the concept behind it. We want to acknowledge the fact sometimes it's very hard to do, to thank your tinnitus for being there, for helping try to warn you and keep you safe. But it can be a very powerful thing. I'll give you a brief example. I think it was 2014. I had a lot of stress going on in my life. I was running a business at the time as well, having young children, lots of things going on, overwhelm. And I had all the signs of a stroke. I lost all the balance on one side of my body. I had double vertical vision. I had vertigo. And they put me in the hospital and said, we can't find anything wrong with you, but we don't know what to do with you. So you're going to go to rehab. And I said, no, I'm not. Send me home. Give me a walker, just send me home. So as I was laying on the couch, just contemplating, guess what started in my ear, my left ear? I had a little bit of hearing loss from this episode, and tinnitus started. Luckily, I knew what it was, and I knew what to do. And so I thought, in my nature of Me laying on a couch, not going anywhere. I'm like, oh my gosh, a little birdie just came to visit me. Thank you so much for keeping me company. And every time it came, I thanked it. And in 3 days, it was gone and hasn't come back. So I didn't create a negative emotional reaction, and I very easily could have had I not known and said, oh my gosh, one more thing, how I'm going to deal with this. And you can see where the body can just start to take over with these things and make it louder because it thinks it's danger. So now we have to look at the autonomic nervous system. This is something that is going on in your body automatically all the time. So I want you to think about a time when maybe you were a little bit scared. Think about how you felt. What did you feel? You know, I kind of liken it to I'm walking through the woods and I see a snake. Oh my God. My heart starts to pound. I start sweating. That's the fight or flight. And see if you can think of a time where you were really calm and relaxed, really in a happy space. And what did your body feel like then? That's the autonomic nervous system. So many people say, yeah, I'm stressed, but no different than anyone else. But in fact, when we're running on the sympathetic portion or the fight or flight, physiologic changes are actually occurring in our body. Our heart rate increases, sweating increases, your mouth can become dry, your eyes can water, digestion stops. Your liver actually releases glucose, which increases your blood sugar, and adrenaline is released, as well as cortisol. And when we're in the parasympathetic, this rest or digest, this is where true self-healing can occur. Heart rate slows down, breathing slows down, digestion starts again. But think of the autonomic nervous system as your car, okay? Because in this day and age, if we think of it as your car and the gas pedal or the brake, we tend to be on the go all the time. And we tend to be tethered down by phones and demands and lots of things. And the more you're stepping on that gas pedal, the more you're on the go all the time, and you aren't stepping on the brake every now and then, the brake gets a little rusty, right? It doesn't work as well as it did if you were, keeping it active. So the parasympathetic, this rest or digest, it's innervated by your vagus nerve, which stems from your ears, and it comes all the way down. And that's what helps promote this rest and this healing phase. But if you're not using your vagus nerve very often, when you go to, it can be a little rusty. It doesn't respond as quickly. And so we want to have a balance of how do we keep this vagus nerve functioning well so when we need and want to relax, we can. We need a balance of these two systems working together. We can't all be in the rest and digest, and we can't all be in the fight or flight. A little bit of stress is really good for us, right? It gets me here talking to you today. I was nervous, sure, but it's got me here, right? It's when you have too much stress and you don't have the coping mechanisms, the tools in your toolbox that you need to work through things, that's when it can become an issue. So stress is not a bad thing, but it's learning to control what you can control and let go of the others. So let's look at how our thoughts play a role. I want you, and be honest with yourself. If I stuck you here and I said, hey, what are you thinking? Most of my patients will be like, oh yeah, that's great. That's beautiful. I'm just sitting there and I'm relaxing and I'm saying, ooh, what pretty water and what pretty mountains. Say, okay, for how long are you thinking that for? Because my guess is your mind is going to start to wander pretty darn quickly because we're human and minds wander all the time, unless you're a trained meditator. And even then, after a period of what? If you're lucky, 45 minutes, your mind is going to wander too, right? So it's really important to know as you are in places, people will say, I went on vacation. So that counts, but it might not, because where your thoughts are plays a huge role into where your autonomic nervous system is. If you are thinking about the past or the future, worries, fears, anxieties, you body, even though it looks like you are resting, your body is actually responding in the fight or flight. If you can be present, calm, grounded, again, it doesn't last very long, but that's when you are in that rest or digest. So one of the things that you need to take away from this is looking at your thought patterns throughout your day. If you are in the past or the future a lot, we need to get your body back into balance. And sometimes this is where meditation, Tai Chi, things that can make you a little bit more focused, can be very helpful. So let's look at the impact of tinnitus. We know, depending on how severe it is for you, that it can affect a lot of things: our sleep, our mood, our concentration, our mental health, and our relationship with others. And this is also where you can look at those questionnaires that I gave you. That GAD-7 is an anxiety screener. The PHQ-9 is a depression screener. And that tinnitus functional index, you can look up the scoring online, but it doesn't tell you what those little sub boxes are, but this is what it stands for. Intrusive is the I, the SC is lack of sense of control, C is cognitive interference, SL was sleep disturbance, A was auditory difficulty, R was relaxation interference, the Q was quality of life reduced, and E stands for emotional distress. So this will help you see what areas of your life you might need to work on. And maybe if it's sleep, with your audiologist or with your primary care, you're talking about better sleep habits. What can I do to help me with my sleep? And I'll be talking a little bit more about this in our treatment section. But this is where you can start to get a feel for auditory difficulty. Well, if I have hearing loss, maybe I should treat it. This is where having tools in your toolbox will help you. And I always send my patients these questionnaires almost every 6 weeks based on what kind of treatment plan they decide that they're going to do. But you can do this for yourself. You don't need an audiologist to send these to you. I just sent them to you. So fill them out and you decide. Maybe you want to start with exercise and meditation. So do it and then fill the forms back out 6 weeks later. Are you improving in any category? And if you're not, we look at the next thing that we're going to do and the next thing that we're going to do. So keep going back to these forms to help guide you. And you could take them with you to your local audiologist if they don't have them for you and say, hey, I did this, help me with this if you can. So we know that stress can really affect the body in all sorts of ways. And there's not enough time in this particular presentation to really get into the whole in and outs of how stress works with the body. But just know that it has been highly researched and that every area of your body can have some issues from stress, including increased tinnitus perception. Even if you don't feel that you may be under stress, you may be. So just looking at your lifestyle and using tinnitus as a guide to be like, what are you trying to tell me right now? When your tinnitus flares, when it changes, is it an indicator that something else is going on in your life at that time? So let's talk about treatment options. So there's lots of different things one can do. And again, we are looking to change how bothersome tinnitus is. I would love to say I could give you a pill and I can just make it go away like that. And in some cases, people will do some of these things and be like, oh yeah, I don't even notice it anymore. Or, yeah, it's there if I pay attention to it, but I'm not as bothered by it. And that's what we're looking to do for you. So the first is medical management. What might this be? Well, once you see your audiologist, they're going to tell you if you need to go see the ENT or the primary care. If you choose to start with one of them, that's fine too. We might recommend, based on what I'm seeing, I might say, oh, let's see a cardiologist or maybe a chiropractor or a physical therapist. This would be issues for that somatic tinnitus, like if it's jaw, your head or your neck, lots of tension being held in the back. Fascia is the lining of all of your muscles, and it runs from your toes right up to your head. And so it's the only connective tissue that's fully connected throughout your whole body. So if you have surgery in one spot, let's say on your knee, that could affect, something up here in your neck because everything's connected. So sometimes we say myofascial release is a good thing for you. That also could be yoga and Tai Chi. That does the same thing. If it's TMJ, we might say see a dentist or a physical therapist, these types of things. If you are seeing an audiologist for medical management, they may or may not use these structured tinnitus programs. The one that I'm describing to you in part today is called tinnitus retraining therapy, but I've modified it and added the mind-body component to it. So when this was developed, the mind-body component wasn't really out there. It wasn't a thing back then. It's a big thing now. And so this uses some directive counseling, some education about what we were just talking about, along with some sound therapy. So we'll talk about sound therapy in a little bit. In a lot of cases, this is repeated sessions over 12 to 24 months. I have found that just by using this type of the talk that I'm giving you, along with some sound therapy and some mindfulness-based strategies, and sometimes asking people to see a cognitive behavioral therapist, they don't need to come back for these sessions, right? They're seeing somebody else to do cognitive behavioral therapy. There is another one with some free resources available to you. It's called Progressive Tinnitus Management. And this was by James Henry and colleagues, and the VA uses this. So it is a stepped program, but they offer some self-help workbooks that are out there that are free. So you could Google PTM or Progressive Tinnitus Management and see what you come up with and take yourself through some of the trainings. There's actually some YouTube things up there as well. So if that speaks to you and you want to give that a try, then I would suggest doing that and looking up that information. The other one is called Tinnitus Activities Treatment. And this is developed by Dr. Richard Tyler out of the University of Iowa. And this focuses on 4 main areas again: thoughts and emotions, hearing, sleep, and concentration, because we know all of these things play a huge role in people's lives. And this is where, again, offered usually by audiologists. There's counseling worksheets and sound therapy. And there are some self-help guides and workbooks. They're not always free, but you could certainly look this up and see if that's also something that you wanted to walk yourself through. You may or may not need such structured programs, but these are what's out there right now to help you if you had an audiologist that was offering this to you. So let's talk about sound therapy. So remember we talked about the limbic system, and we don't want to mask our tinnitus with other sound. You've probably heard of masking. We do want to use environmental sound if you can. If you have hearing loss, we use hearing aids. But we do want to use some type of external sound that you find to be very comfortable. We don't want to make it so loud that you can't hear your own ringing, because we can't teach the body that it's not danger if you can't hear it. What happens if you mask your tinnitus, what happens when you turn off the masking noise? The tinnitus is still there, just as loud, right? So what happens though, usually I'll ask my patient, okay, listen to your tinnitus, no hearing aid on. Listen to your tinnitus on a scale of 1 to 10, how loud is it? Maybe it's an 8, okay. So now we put on some other sound, whether it's a hearing aid or a box fan or whatever, an app. And how loud is it now? What I'm looking for is that it might come down from an 8 to a 7 or a 6. That is good. If it comes down even further, that's fine. Even if it's not that loud, some people absolutely say with the use of a properly fit hearing aid, they don't hear their tinnitus anymore. We'll talk about properly fit hearing aids in just a second. But if you can bring it down a little bit, your body isn't overreacting as much. It kind of has a chance to relax a little bit. So if you find some other sound, and it used to be they said, oh, it has to be white noise, it has to be pink noise. Actually, it has to be something you find enjoyable and relaxing. If you don't like the sound of white noise or pink noise, that is not helping you. So find something that you find to be comfortable. And you could do it, like I say, with any type of sound in your own environment. So when you go to sleep, not the TV. Don't use the TV. The TV has other shows. You never know what's coming on. Use some type of fan or a sound machine or an app on your phone with a speaker. You could absolutely use this type of sleep headband and find some type of sound. And here, this is called Resound Relief app. There are so many apps out there that can play different tinnitus relief sounds. Most people have to layer sounds to come up with something that they like. And you want to play that throughout the night. So when you're going into your room, you have it already turned on. If you wear hearing aids, this sound is already on before you take out your hearing aids. You leave it on all night long. So it's not stopping in the middle of the night. When you wake up in the morning, it is still running. Some people notice their tinnitus flares in the morning, and it could be that they're clenching their teeth. It could be how they were laying. It could be just because it's silent and now you hear it. So these are some things that you can do at bedtime to help you. Also, stretching is a very helpful thing to do before bed. Really get some good stretches in and less screen time. So setting that relaxation, yourself up for relaxation to be able to go in and then fall asleep. So ear level sound therapy. This is when, if you don't have hearing loss, we might use a sound generator, which looks like a hearing aid, but the hearing aid microphones are turned off. It could be a hearing aid with a combination sound. And this is where, when you're being fit for hearing aids, so this warrants a little bit of a talk because AirPods can now, I have AirPods in right now, so you can hear me. AirPods, you probably have known, have a hearing aid feature in them, some of the new ones, right? Does that mean it's going to work for you? It may or may not, depends on how much hearing loss you have. Same thing with over-the-counter hearing aids. So here's kind of the key. You know when you lose your eyesight, you're the very first person to know that it's blurry. So you go out and you can buy cheaters until they don't work anymore, and then you need to get prescription. The problem with hearing loss is you start to lose it before you ever realize it. Other people will realize it before you do. On average, it takes people 7 years to realize they have some form of hearing loss, unless they're very attuned to their body. Over-the-counter hearing aids, or AirPods even, are meant for this very, very basic, barely any hearing loss. They're not customized, per se, directly to your needs, nor to your tinnitus. But if you have barely any hearing loss, it may be enough. So, if that's the case, try it. If you have a lot of hearing loss, your best bet is to see an audiologist who uses VeriFit speech mapping. That is the gold standard of fitting any hearing aid. A lot of people use it and a lot of people don't use it. So you might ask when you go to be fit, do you use speech mapping? And what is it? It's where we can measure your ear's response to what's coming out of the hearing aid. What I like to do is when I find where your tinnitus is, I want to give you back some volume there. Okay? And I can see that on my speech mapping. So if I know you have tinnitus at 4,000 hertz, I want to make sure I give you some amplification at 4,000 hertz because that's going to help you not hear your own tinnitus as loudly. I saw a gentleman today who he came from 2 hours away and he had hearing aids, but they never speech mapped him. And when I did, and he said, yeah, they're okay, but they're not great. And my tinnitus is still driving me crazy. When I speech mapped them, they weren't fitting his hearing loss appropriately. So I said, go back, have them retune these, ask for this test, see if they'll do the test. And then we can talk about some other options. But usually it's well-fitted hearing aids. When you have them, you don't notice your own tinnitus nearly as much. So that is something to talk to your audiologist about. The other thing with any type of hearing aid, whether it's over the counter or not, or custom, an expensive pair that you buy, they can be Bluetooth these days, even AirPods. So you can stream in sounds and still continue to hear. So you may have some other sounds set at a very low level as you're still being able to hear and listen and talk to other people. For some people who have normal hearing, that they don't need hearing aids and they don't want anything like an actual hearing aid in their ear, you can buy bone conduction headphones. I don't know if you've ever seen them, but they sit over your ears and then you can stream into that and it keeps your ears open. The battery life on those devices, on AirPods and on bone conduction headphones, they don't last as long as hearing aid battery life lasts. So you may find that it's just more convenient to have something fit to you if you need that. But this is how sound therapy can help. So using some type of sound, whether it's customized to you or not, to avoid silence. And it doesn't have to be for the rest of your life. Some people will say, I love silence, but enough to help retrain your body that tinnitus is not dangerous. And once that happens, then you may be able to go back to, not having to do that. So let's now move on to stress management and cognitive behavioral therapy. Again, all evidence-based things that can help reduce the annoyance and change your thought patterns. So the first one I'm going to talk about is called mindfulness-based stress reduction. There's lots of ways to meditate. This class is, it started in the 70s from Jon Kabat-Zinn. He was a molecular biologist who also happened to be a Buddhist and did yoga. And so he created this program for people who were having health issues, who were making it through in the 70s. This is when vaccines were coming out and MRI machines and whatnot. So we're keeping people alive longer, but they were suffering more with ailments. And so this group is taught worldwide. There are teachers trained all over the United States and the world, actually. You can Google this. This group is typically taught, or this class is typically taught in a group of people where you're either online or you're in person, and you might have tinnitus, you might have diabetes, you might have high blood pressure, you might just be coming because you're super stressed out. But you're all coming together and you're learning techniques that you can apply to your own body and to your own health elements. If you prefer a class that is on your own, self-paced, there is one online that is geared toward tinnitus that if you weren't getting this type of information right now, it is also given in that. And that's just mindfulness-based tinnitus stress reduction class. And that's online as well. For basic free information, Google this MBSR free and see what pops up. I know there's a site on the internet called Pelus that offers some free tools and strategies. And most of the teachers who teach this class do a sliding scale and take people for free at times, so it never hurts to reach out and ask. Mindfulness-based cognitive behavioral therapy is a huge one. This is called third wave cognitive behavioral therapy using the mindfulness-based, and this has a very, very good approach to helping people cope with the thoughts about the tinnitus. And this is something that I actually have a lot of my patients who have bothersome tinnitus do. There are some apps out there that can also be OTO is one of them. You get that through your audiologist. That is also based on cognitive behavioral therapy. But this is something that is one of the biggest things that can help you. So ask your insurance company. They can recommend somebody to you who does this. You can Google it. You can reach out to the ATA. They know people in different states who may offer it for you, depending on where you come from. This is very important when we start to talk about linear, which you may have heard about, because having your thoughts under control about your tinnitus is a huge benefit to helping you succeed with any other treatment that you try. Meditation and Tai Chi, we've talked about that. And there's different apps that you can get for meditation and those types of things. And their OTO, that is the cognitive behavioral therapy app that you can get through your audiologist. So let's talk a little bit about Linear. So Linear is the first FDA approved bimodal tinnitus treatment device. There are others that are being researched. They're just not out and yet approved. So what is this? This is a tongue tip that sits on your tongue, and you see those little silver things, little electrodes that stimulate your tongue. It kind of feels like little pop rocks, okay? Little tiny like zaps to your tongue. It does not hurt. I have anxiety when I tried it. I thought, can I do this? It was perfectly fine. The controller controls the tongue tip stimulation and also the sound that's coming from the headphones. And in the headphones, there is music. It's like there's some relaxation music in there along with these boop, 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 boop. And it's correlated into your hearing loss. The tongue tip and the sound kind of go together. Less is more, turning it up so you have like total stimulation on your tongue made my teeth go numb. When I turned it back down and waited an hour, my teeth went back to normal. It was fine. So let's look at this. What is it doing? This is that whole neuroplasticity thing again, right? We're using two forms of stimulation, bimodal, to boost these neuroplastic changes in the brain to reduce subjectively how loud you hear your tinnitus. How do we do it? 2 times a day for 30 minutes each session for 12 weeks. And some people continue to go on and do it for longer. Some people stop. Okay, so what have I learned about it? I'll show you their case study in a minute. Most people will tell me that, and it's not just me, everybody, that their tinnitus may increase after a session with it. And it's almost always temporary. So if you are not okay with the fact that your tinnitus may fluctuate and change, which we know to be true from life in general, right? Sometimes we can change it by moving our jaw. Sometimes it changes when we're more stressed out. If it throws you off that you do this and your tinnitus gets louder for a period of time and you don't have the skills to manage that, it is not the time for you to start using Linear. You have to be okay with the fact that tinnitus will fluctuate and change. That is normal. It does not mean it's getting worse or it will last. But it does mean things are happening, and to be able to relax through that and breathe through it is very, very important. I've had some people start Linear who, for whatever reason, told me they were going to do the cognitive behavioral therapy first and couldn't. And in their lives, the 2 or 3 people I'm thinking of also had a lot of stress going on. They were taking care of elderly parents. One had a child who was having some issues. So lots of stress that you can't necessarily get away from, right? That's their responsibility. So they found that using it at that time and then their negative thoughts about their tinnitus flaring, they had to stop using it for a period of time because it had become a negative in their eyes. And every time they went to look at it, it was like, oh my God, am I going to have my tinnitus flare again? And that's not a good way to go about trying to help, right? So I say, put it down. Just let it go for right now. We can go back to using it later. Let's work on our thoughts about this. And that's where finding that cognitive behavioral therapy can be extremely helpful, unless you're already okay knowing that it may fluctuate and it will come back down. So in their 10A3, their latest trial, they did 2 stages. They did sound only, and then they did the sound plus the tongue. So you can see typically they only like to let people use it who have a moderate or higher on their tinnitus handicap inventory. But you can see here 58% of people responded with a 7-point improvement on that handicap inventory with the tongue stimulation and sound, compared to 43% who was sound only did. So even sound only had some good benefit, right? The 0 side effects they have found usually, and like I said, everyone who reported that their tinnitus fluctuated, who stayed in the study, it came back down. So 70% of people who did not respond to sound only still saw significant improvements. It's not suitable if you have a pacemaker, you're pregnant, you have epilepsy, any tongue issues, or chronic neuralgia or pain in the head. And I just wanted to show you from my clinic, I pulled out some random case studies of people who've tried different things to show you what's possible. So Adam is 45 years old. He had normal hearing. And when I did high frequency audiometry, he did have a little bit of hearing loss way out in the highs, but not enough to cause an impairment with communication. Certainly didn't need to wear hearing aids. He also clenched his teeth and could modulate his tinnitus by moving his jaw. I basically gave him this talk, and he went from a 76 severe down to a 17 mild in those 2 months. His anxiety went from a 15 to a 5. Depression went from a 16 to a 10. And then you can see that all of his subscales has come down as well. Larry is the next one, 64-year-old. Now, he had some normal hearing, but he did slope to a moderate to severe high frequency hearing loss. So his tinnitus was due to his hearing loss. He had a lot of tension in his head, neck, and jaw. Larry took a little longer. He wears hearing aids. He did do cognitive behavioral therapy. He took the MBSR course, and he continues to meditate daily. And he took my MBSR course, and I lead a monthly meetup. So I'm with him every month just for meditation. And he went in 2021, he was a 66. And then he came down. I didn't score it in between, but by 23, he was down to no handicap at all. And he maintains that to this day. So when we look for, can we reduce it? Can we reduce it long term? So that's what we want to see, that over time, all of these scores still come down. And so he used a combination of things. That's usually what we see. For those who are bothered the most, it's a combination approach. It's not one size fits all. Heidi is 62. Again, everyone seems to have somewhat of the same similar hearing loss that I picked, not on purpose. Normal hearing sloping to a mild to moderate. And this person had hearing loss. She had tinnitus for a while and it didn't bother her. And then stress was going on in her life, and that really turned it into a bothersome. So she used linear. She decided to go right for that and did not want hearing aids. So we did, her initial was a 44. 6 weeks later, she was down to a 28. And at the 12-week mark, she was down to a 12. And again, you can see that her scores here, auditory difficulty went from a 27 to a 6. Relaxation interference went from a 30 to a 0. So you can see where I'm talking about, other things. Now, if I were to go back and work with her, I would say, you're still showing that you have this sense that you don't have enough control over it. Maybe now we need to talk about hearing aids, or let's talk about something else to give you more tools in your toolbox so you feel more in control. And Anne, 73 years old, normal hearing, sloping to mild to moderate. Tinnitus was due to her hearing loss, TMJ and stress. Stress caused hers to flare up as well. She used hearing aids, but because the stress was coming and going, she chose to also add meditation to it. And once again, her scores, she was only a mild to begin with, and then she went to no handicap. And she's maintained that over the years as well. So I wanted to show you the case studies because, as I said, it's not one size fits all. Um, with linear, it can be expensive, and you don't get your money back if you don't like it or it doesn't work. It's an FDA approved device. It cannot be transferred to anyone else. You can't sell it on the black market. It only works with a tongue tip, and that they're very strictly controlled. So it's worth looking and speaking to an audiologist and to looking at your own forms to decide what might be the best course of treatment for you. So your next steps would be to find a provider near you. So you can go to ata.org, find your healthcare provider, and that may list it may list out some people who treat tinnitus. I know the ATA, we don't vet people when you join as a member or a professional. You just say that you're a professional, but we are not yet vetting anyone to make sure that they're doing the same type of presentation I'm doing by any stretch. So you may find some differences in varieties of what's being offered out there, but all of this is what's evidence-based, and by joining the ATA as your partner, you are actually getting some very good help along the way with that magazine and just supporting all of their research. So if that is something that you think that you would like to look into becoming a member, you could join today. It is a 4-star charity on the Charity Navigator score. And if you found this to be helpful at all and you wanted to make a donation to them to fund their research and their 1-800 hotline and the magazine, you could do that as well. You don't have to, but I put that up there for you. And other than that, we are 3 or 4 minutes over, and it is time for questions. So I am going to stop sharing my screen.